Hey, welcome to Facebook Live at CGH Medical Center. I'm Dr. Bill Bird, Chief Medical Officer at CGH Medical Center. Thanks for joining me on this broadcast. So today, it is just going to be me. What we're going to try to get in a rhythm of is we're going to do every week, at least for the time being, an update on what's going on with COVID, as that's what we started these broadcasts about. And about once a month, we'll have one of our medical staff on to talk about some medical related topic. And we'll do that. But this week is COVID. And I'm going to do this in the format of, I'm going to give you some facts. I'm going to talk about some latest news in regards to COVID. I'm going to bring up some questions that are still lingering right now, and then give you some analysis and recommendations. And of course, during the course of this, as you have questions, please send them my way, and I will do my very best to answer them. So let's start with some facts. And Matt, I'm gonna have Matt throw up some graphs here. So top left, over on the left side there, red is this week, blue is the previous week, and bottom left is the past 2 weeks, and then the blue is the 2 weeks prior to that. So you can see from that graph that we are still trending upward in terms of our cases. Matt, if you go back to that, and then if you look at the positivity rate is 6.1%, which is pretty much mirroring the state average. And if you look at the bottom right, you'll see the number of the bars of the number of cases. And you can see that we're definitely trending up as compared to how we were in June and July. You look there in March and April, I think we got as high, it looks like, as around 50 something, and not a little, but a surge we had then. And it doesn't go back this far, but I was talking with our staff, and actually on November 7th, which was when a really significant surge happened, we had 142 new cases on that particular day. So what's the next graph that we wanted to show, Matt? Okay, so that's the 25th. So that's just yesterday, and you could see that we had 27 cases. Positivity rates a little bit below the state, but yeah, so we're definitely, unfortunately, moving onward and upward in terms of our cases here in this area. Thanks, Matt. So some more stats, some more facts. I think it was the day before yesterday I last looked. Illinois had 4,451 new cases and 40 deaths. The U.S., the day before yesterday, was averaging about 125,000 cases per day for that week. Just, you think about it, I think that's about the size of Rockford. So, I mean, it just tells you how many people are getting sick right now. And those are just the reported ones. Worldwide, and I think in the U.S. on that particular day, a couple days ago, they reported out 677 deaths. In the world, right now, the number I saw like a day or so ago was 2.07 million deaths. Other facts we know about the Delta variant, that it's spread in the hottest spots right now. The South in particular has still really high, but it has by and large plateaued in those areas, and now it seems like it's trending more in our areas in terms of going up. We know about the Delta that it's around 2 times more likely that you can get Delta than the previous variant that was most prominent. And the Delta variant is about 99% of the cases that we're seeing in our country right now. Yeah, 5 billion vaccine doses have been given across the world thus far in 183 countries. Illinois, for vaccinations, we averaged 24,196 vaccinations a day this past week. So vaccines are still being given to folks. So it's good. There's still folks who are willing to get vaccinated. and that's good. For over the age of 12, which is the age that people in the state of Illinois can get vaccinated, 58.9% are fully vaccinated and 75.9% are partially vaccinated as of yesterday. And you think about, and when you look at the effectiveness of the vaccines, it's sure trending towards Moderna's a little more effective than Pfizer, which is a little more effective than J&J against this Delta variant. Another fact that continues to hold up is that vaccines are very effective in preventing hospitalizations and deaths. One small study in California, they were 29 times more effective in preventing hospitalization than for vaccinated people versus unvaccinated people. So those are some facts I wanted to share with you. And one other fact I think I wanted to show that on the facts side. Yeah. So it's kind of fact, kind of a little bit of analysis, but you think about 2.07 people have died in this world since this pandemic started, thereabouts. And you think about in our country right now, we're trending 600 or more deaths a day. I am certain and I shouldn't laugh about this. I am certain that the number of deaths and problems occurring as a result of people getting vaccinated is nowhere near those numbers. Nowhere near those numbers. So the positive side, the plus side, the pro side of getting vaccinated far outweighs the con side of any vaccination side effects, even long-term ones. So here's a question that came up. How many of the new positive cases are people who have been vaccinated? Yeah, I would say the trend is that we're definitely far more patients that are getting sick, and particularly those who are getting hospitalized or unvaccinated. But we are seeing a trend with this Delta variant to beginning to see even some vaccinated folks who are getting COVID symptoms and getting sick. Not typically hospitalized, but getting sick. So yeah, I don't have any specific numbers, but that's what I would say. If I have asthma, should I get the booster now? I am vaccinated. So I would say that right now, the booster shot, that third shot that's been approved, is approved for folks who are immunocompromised in some way. So that typically would fall under the category of people who have had solid organ transplants, people who are receiving cancer treatments, patients who are getting some type of medication that affects their immune system. So, and also like HIV patients, HIV positive patients. So those would be the typical folks that should get a third vaccine now. And that's been approved, and we're giving those here at the hospital for folks who come in or talk to their doctor who want one. So for an asthmatic patient, I guess I would say no. Right now, you would fall into that bucket of the potential booster shot for everyone else right now, unless as an asthma patient, you were on some medicine like prednisone or something else that would affect your immune system. And when I say prednisone, I don't say prednisone just for a week or two if you're having an asthma flare, but prednisone, day after day after day. Or if you have COPD and you're on prednisone, chronically, then I think you might fall into that immunocompromised bucket and you should get a vaccine now. Hope that helps. I saw one other question that came up. Okay, I'm at frustration level when I ask people and they're not vaccinated. Went to a financial advisor. Sounds like the financial advisor came up that they weren't vaccinated, and this viewer felt like that was just it was tough to concentrate. And do we have any response? We'll keep promoting the vaccine and just say it is what it is. Yeah. So this will segue into one of the news items that I'm going to talk about in just a minute or two. But yeah, it is distracting when you think about being around folks and not knowing if they're vaccinated or not, and not knowing, they're much more likely then to get sick, and then you can get sick from them with this Delta variant. So I completely understand our viewers' question and comments there. And I'm going to, and I don't think it is what it is. And going back to the facts part of this, I do think that folks are beginning, even now, we are continuing to see vaccinations happen, which I think is a good sign. And we're starting to see a tick up in those vaccinations, which I also think is a good sign that folks are continuing to hear that message. And it's not like everyone is just set on not getting vaccinated. I think people continue to make those decisions, and this, as frustrating it can be at times that not everyone just has gone ahead and gotten vaccinated. I think it's still happening, and we're continuing to support that. News. Here's some news stuff. Just this morning, the governor came out with a recommendation of a mask mandate for all people in the state of Illinois when they're indoors. This starts Monday, whether you're vaccinated or unvaccinated. Mask mandate starts Monday indoors for everyone in the state of Illinois. Number two, vaccine and or testing mandate for healthcare workers, school teachers, and I think there's a couple other buckets, but for the purposes of our hospital that we're aware of this morning, is the governor came out with a mandate that healthcare workers, this is by September 5th, need to be vaccinated or tested at least weekly if they're unvaccinated. So that is what's going to be happening as of September 5th. I read a little bit of this, and it also sounds like when I say tested at least weekly, that depending upon what area in terms of how the transmission rate and how prevalent COVID is in a particular area, that testing frequency may be more than once a week. I think we're going to get more details here in the next week or so, as this is going to be coming down and happening fairly quickly. Also news, monoclonal antibodies. So this is a treatment for folks to try to keep them from getting hospitalized with COVID. So now the FDA has approved that treatment, this monoclonal antibody treatment. And this has been the case for folks who have symptoms and are positive for COVID and are at high risk for getting sick, that they can get this infusion that we give here at the hospital. Now, within the last few weeks, also FDA has approved that infusion for folks who don't have symptoms, but are at high risk from getting really sick from COVID, and who have had a significant exposure to someone who's COVID positive. So that's another bucket of people that potentially would benefit from this treatment. I saw an article that about what Dr. Fauci had said about this treatment, and he threw out numbers this week that people who receive this treatment are between 70 and 85% less likely to be hospitalized if they get it, if they get the infusion. It's a one-time infusion. So just putting that out there, if you know, or you're someone that you happen to know could fall into that category, I encourage you or them to reach out to their primary care physician and have a conversation about that and see. There are definitely some criteria in terms of timing for each one of those categories of patients in terms of how soon they need to have that infusion done for it to be effective. Also, I would say about that infusion that I think the government right now at least is paying for the medication to be given. I think there's a cost for just us administering the infusion to patients, but yeah, so it's a covered expense by and large, other than the infusion, us giving the infusion cost. So I wanted to let people know about that piece of news. And then I kind of alluded to this because it came up previously, but yeah, the third booster shot for folks who have immunocompromised conditions has been approved as well. So some significant news since I last had a Facebook Live. I know Dr. Coons did it last week. I'm not sure if he mentioned if it was up last week or not. Ken is asking, when will the Moderna booster be available? I don't know, Ken. First of all, the Moderna final FDA approval versus the emergency use. I think I'm hearing that they either submitted or really soon are going to submit their paperwork to get that. So I have a feeling that may play into when Moderna, the third shot, would be accessible for people, but I don't have a specific date for you on that. I think it's really likely, though, that that's going to obviously be available at some point in time. Yes, Marianne, most CGH employees are vaccinated. The last number I saw was around 80%, which is pretty typical for hospitals that I'm reading about who don't have mandates. And the other thing I would add about that, Marianne, that's definitely better than our general population here in Whiteside County in terms of our overall average. Okay, I think that's the news side of things. Now the questions. Questions. Oh, and when I say questions, these are just questions that are still out there in terms of this pandemic and how things are going to play out. First one is kind of some of our viewers have already brought this up. The third shot, or the booster shot for people who don't have immunocompromised conditions. Is it going to be recommended? And if so, when? And I've seen September 20th thrown out, but I do think there's still some conversation about whether to do it and when to do it. So I think that there's still some conversation about that. Yeah, other questions. I'm seeing some data come out about this, but it's still not clear how much less effective at preventing illness and hospitalizations our current vaccines are with this Delta variant. The data is still flowing in. Not as effective. They still seem to be really effective in terms of hospitalization and death, and more effective than not getting vaccinated for getting sick. But actual numbers, still, I think that data is still coming in. And then one of the things that's kind of been going through my mind lately is this the last wave? I don't know. Matt, would you put up our graph that we do once in a while? Yeah, so, and you notice, Matt, Matt's making the arrow go both directions there. So what this graph is showing is that natural immunity is people that have gotten sick from COVID, particularly now this Delta variant, but have gotten sick from COVID just in general, and people that have been vaccinated. That helps to prevent more people from getting sick, and that helps to prevent further waves. And then below that, you have variants and behavior. And on the variant side, is Delta our last variant? Will there be others? Will those others be as easily transmitted? Can people get as sick as easier than Delta, or less easy? And will they make people sicker or less sick? So we don't know. I don't know, at least. And then behavior, of course, is always a variable in terms of how seriously, for instance, will people take the governor's mask mandate? And so, how good will folks do about following that, and social distancing and those type of things? All that plays into that question I had of, is this the last wave? So thanks, Matt, for showing that. So those are questions. And in terms of analysis and recommendations, I think my first analysis or comment would be, sometimes I think we think that there are questions still unanswered, and we think that is bad. I don't think so. I think that's how science, in many ways, life is supposed to work. You get data. Oftentimes it's imperfect. And based upon that data, you make a decision. And then you hope to get a little less imperfect data. And then you tweak your decisions and make a different decision, or at least make a adjustment to it based upon that information. And that keeps happening. And that's what we're seeing. That's how things are supposed to work. Now, what's important, our values don't change. And so I think in terms of, I think what most people would agree is what we're trying to do is we're trying to protect as many people as possible from getting this disease and from dying from it, versus allowing as much individual. I'm sorry, I'm on call today. Versus allowing as much individual freedom as we can, as you can within those parameters. And so the recommendations are going to change based upon more information, but those values of what's important and what is a society we're trying to accomplish, those are going to stay pretty consistent. And I think that's reasonable. So I think that would be kind of my analysis, editorial, if you will, on the whole situation. And there was a question: can we get the Pfizer booster if the Moderna booster isn't available, even though we got the Moderna vaccines? Good question. I don't know. I think we're going to, as we get closer, first of all, the decision has to be made whether we're going to go forward with those boosters. And then once that decision is made, then I hear what you're saying. I think there's going to be some conversation about, can you mix and match? If you got a J&J, do you need to get another J&J, or can you get one of the others? I don't know. Once kind of going to my opinion, to my editorial there, is that there's definitely going to be some more science and data coming forward about that, and we'll have to make a decision, the best decision we can, based upon the information we have at that time. I think I saw another question. Yep. Is the vaccine safe for pregnant women, breastfeeding mothers? Yep. The data I've seen so far looks as though it's safe for breastfeeding mothers and pregnant women. And in particular, the numbers I was seeing, and of course this can change, but what I'm seeing was that in terms of potential, let's say miscarriages, the numbers are exactly the same for vaccinated versus unvaccinated women, which would suggest that the vaccine has no bearing upon that in pregnancy and outcomes in pregnancy and those type of things. Good questions. How can you tell if a person tests positive for Delta? Is there a specific test? What cycle threshold does CGH use for testing? PCR tests cannot differentiate between flu or COVID. So there's several questions bundled up there. So first of all, 99%, 98% of people who are testing positive right now, based upon state and national numbers, are Delta. So I think we can just pretty much assume if you're testing positive right now, you have the Delta variant. And then there are a couple different tests that can, there's not a specific, as far as the Delta thing, those are done at state and national lab levels, not here at the hospital. And cycle threshold, the CGH used for testing, I'm not quite sure what we're getting at there, but I will say that actually PCR tests can differentiate between flu or COVID. As a matter of fact, during the flu season, we had a PCR test, that tested for four things. It tested for COVID, it tested for influenza A, influenza B, and something called RSV, or respiratory syncytial virus. So actually the PCR test can differentiate between those. I hope that helps in terms of testing questions, but we are doing PCR testing on our patients here at the hospital. We don't have, our supply of the rapid tests where we can do that PCR test in like an hour and a half from the time you swab someone to the time you have results is better, but not good enough that we can just do that on everybody. So most patients who we're just sending, who come here who don't need to be hospitalized, we're doing send out tests still. And we get those test results back in a day or two. So that's kind of where we're at. Donna, they deal in patient care, be role models, promote the vaccine, others in our community. It somehow feels hypocritical. I understand your sentiments, Donna. I understand your sentiments. The governor's mandate is going to be very helpful in terms of what you're wanting to see happen. So, I hear what you're saying. Mary Rodriguez, is CGH and surrounding clinics still running at full staff, or are you seeing a shortage of medical staff? Yeah, this is a countrywide phenomena. Was it Mary Ann that asked that question? I think it was. Uh, Mary Rodriguez. Yeah, this is a nationwide issue. We're just seeing a shortage of staff trying to get things covered. And yeah, it's a nationwide. So yes, here at the hospital, that's an issue too. I feel like we're able to take care of the people that we have and do a good job with it. But there are times when our staff is stretched pretty thin. Let's see. My sister-in-law had surgery yesterday. She had a COVID test before, and they did it in the mouth. Is that how the testing is done now? Marianne, I think here at CGH, unless she had her procedure done here at CGH, I think at CGH we're still doing the PCR testing. And my understanding, we can check on that. I know our folks that are behind the scenes while we're talking with you are going to look into that, and we can try to post that for you. My understanding here at the hospital, though, when the PCR testing is, it's still a nasal test. And I think, by and large, that test is when you're getting some from someone's mouth is an antigen test that they're talking about. So that and from my understanding, the antigen test is still not quite as good as the PCR, not quite as sensitive as the PCR test is. So, man, a lot of good questions today, and I've gone pretty longer, a little bit longer than I thought I would. I thank for those of you who stuck with me and listened. So the plan is I'll be back next week, and I'll give you an update on what's going on with COVID here at CGH and kind of a broader perspective as best I can. Hope between now and then we'll have more questions of yours that we can answer definitively. I thank you for listening. Thank you for, and I guess my recommendations are pretty simple. Get vaccinated, wear a mask all the time when you're indoors, and try to socially distance as best you possibly can. Do those things, control those things. And until I come back on next week, I hope all of you have a safe week. Thank you.